when you look at the rates per, it has the actual absolute case count as well as the rate per 100,000 residents. And when we do look at the numbers, and this was before today, so the numbers reflect 292 COVID-related fatalities. The rates for non-Hispanic Black residents of Montgomery County is 41.1 per 100,000 residents, followed by non-Hispanic White at 31.2, Hispanic at 18.8, and non-Hispanic Asian at 14.3. And as we have made a promise from the very beginning, as we continue to get more information to showcase and highlight the profile and the impact of COVID-19 in our community, we're doing so and working to turn that around very quickly.
Today, we kind of reached this grim milestone of crossing 300 confirmed deaths. We're at 304 with another 29 probable. This is, what we've expected, and we have people who've been sick for a while, and so this is going to be with us for a while. I want to acknowledge that there's a growing sense of quarantine fatigue, I guess they're calling it. I get it. I think we're all fatigued, but we're doing the right thing, and it was the best strategy to stop the spread of the virus and to keep it under control.
What happens is when a case comes in to disease control, the nursing home is notified. And as part of that process, the patient's representative and family are notified as well of that result. And an investigation is initiated. And part of that investigation includes completing what's called a line list. And the line list goes through and basically charts any individuals who have tested positive, whether they're residents or staff members. It also, as part of that investigation, there are lots of questions asked in terms of trying to ascertain who are contacts of those cases. Are there other residents? Are there other staff members who've come into contact with those individuals who have tested positive? Now, what happens is over time, the staff and disease control and members of kind of our nursing action team, they check in on a regular basis with the facilities to see if there are any other individuals who've developed symptoms who require testing or have been tested and have received results. And so that information is tracked on a regular basis. And as part of the disease control process. And so in terms of reporting, there's regular conversations and communications to track and keep an active list of those individuals who have tested positive, residents and staff who are considered to be contacts, any individuals who've been tested, whether they're tested positive or negative, and in some cases, any COVID-related fatalities.
I'm aware that Governor Northam in Virginia has talked a little bit about opening. I also know that the Northern Virginia leaders are encouraging him to separate their counties out from the rest of the state if need be, and to focus on a regional strategy, because what we all know is that if we don't act together, and we have some places that maybe have more hot spots than others, that no matter what I do here, if people come in from someplace else that is being less rigorous, we could wind up re-triggering the problem that we've had to a greater degree. So it's very important where you've got very fluid borders, lots of movement back and forth across borders, that everybody be working together. We're going to continue to look for the governor for guidance on this in the state. He's at least made me relatively comfortable, because he keeps talking about that health is going to be his first consideration.